How do we classify our blood gases? To do that, you must know your normals. You must know your normal range and have them memorized. What is our pH range? The pH range is 7.35 to 7.45. This is the normal range. The exact balancing point is 7.40. Anything greater than 7.40 is basic. Anything less than 7.40 is acidic. Another word for basic is alkalotic. I use these words interchangeably. Basic or alkalotic, and acid and acidic. Let's take a look at CO2. Here we have a range of 35 to 45 with an exact balancing point at 40. Now CO2 is an acid. Carbonic acid is a good one. And more of it is, of course, acidic. Less of it, if we have less of it, then it is basic or alkalotic. Let's jump over to bicarb. Here's our bicarb. Bicarbonate of soda, baking soda, sodium bicarb is a base. It is a base. So if we have a lot of it, it's going to be basic or alkalotic. Basic or alkalotic. If we have less of it, of course, if you have less of a base, then it's going to be left with an acid or acidic. Excellent. We have to memorize these normals. Here we have PO2. Let's talk about PO2 really quickly. We have a condition of normalcy, which is a PO2 between 80 and 100. If we're greater than 100, we are going to be hyperoxygenated. If we're hyperoxygenated, that's a bad thing. Oxygen is a poison. It's a toxin. It's toxic. So don't over-oxygenate your patient. Oxygen is a good thing. If we don't get enough, we die. So don't get your patient hypoxic either. Hypoxic is a condition less than 80. And we have a condition of hypoxemia. We're going to break that down now over here. Hypoxemia. There are 3 levels. There are 3 levels. Normal is down to 80, so anything that is 79 down to 60 is mild. We end at 60, so the next one starts at 59 and drops 20, which would come up to almost 40. And that's moderate. And then anything less than 40 is severe. So we have 3 levels of hypoxemia. Mild hypoxemia, moderate hypoxemia, and severe hypoxemia. Many people live in mild hypoxemia all the time. Chronic obstructive pulmonary disease patients, COPD patients, suffer from the ability to get oxygen into their lungs. A low level of oxygen is perfectly tolerated by them, so we get a blood gas and they're mildly hypoxic. We can continue with their treatment the way that they are. We're not very concerned as long as this is normal for them. When people get into the moderate range, then of course we must look at the question of respiratory failure. That's another condition. Forget about what I just said, cut that out. So there's 3 levels of hypoxemia that we must classify. So memorize these. Boom, boom, boom. Great. Now let's do a breakdown on this blood gas. pH 728. Where does it fall? It falls way to the left of this pH. So it's extremely acidic. So of course we call it acidic. Or we call it an acidosis because it is 728, far to the left of 7.40. The next question, is it within the normal range? No, 7.28 is outside of the normal range, so we know that it is not fully compensated. Anything that is fully compensated has to move the pH back into the normal range. So since this is outside of the normal range, we either know that it is uncompensated or partially compensated. So we have an acidosis. Let's look at the CO2. The CO2 is controlled by the lungs, by the respiratory system. Here we have a CO2 of 80. Well, 80 is going to be way over here on this side. So we have a acidosis. This acidosis is caused by the respiratory system. So we'll call this a respiratory acidosis. And now let's look at our bicarb. Our bicarbs are controlled by our kidneys. We like to think of that as the metabolic system. So what has our kidneys done? It's 22. 22 is in the normal range. Since our bicarb is still within the normal range, we say it is not compensating. So here we'll say that this is uncompensated. Uncompensated respiratory acidosis. The bicarb takes a little bit of time for it to compensate. It might take hours, days, weeks, depending on the function of the kidneys. So usually it takes days, and since we haven't had any movement outside of the normal range, it's uncompensated. Since it's uncompensated, we could also say that it is acute, because it just must have happened. Now, let's look at our PO2. Our PO2 is less than 80, 52. So we remember 79 to 60 is mild hypoxemia, and this is less. This is 52. We remember that 59 to 40 is moderate. And we remember that less than 40 is severe. And 52 is going to be right here. So we say that this is a moderate hypoxemia. Hypoxemia, H-Y-P-O-X. A condition of not having enough oxygen. Emia, E-M-I-A, in the blood. So we know, because we've drawn this gas from the blood, that there's not enough oxygen in the blood. Acute, uncompensated respiratory acidosis with moderate hypoxemia. so easy to do and so fun. You must memorize your ranges. You must know which way is acidic, which way is basic. Love it. If you watch this whole thing, I hope you like this. I hope you like this video and subscribe for more fun with blood gases.